Shri Gurubhyo Namaha. Very good evening and warm welcome for today's cosmetology webinar on Acanthosis Nigricans, organized by AyurvedaMap and initiated by MedMap. On behalf of AyurvedaMap, I welcome you all for today's session. Myself, Dr. Akshata, I'll be moderating the session today. So before we move on to the free webinar, so I would just like to introduce you all for the upcoming sessions, upcoming courses of AyurvedaMap. So, before we begin with today's webinar, specialization is the need of the hour. So just BAMS or having a postgraduate degree in Ayurveda is not enough today. So always having a specialization is an add-on, and it's the trend nowadays. So for graduates, BAMS graduates, after completion of BAMS, so the question arises, what next after BAMS? So AyurvedaMap is offering different specialization courses, diploma and postgraduate diploma courses. So based upon your convenience and your availability and the time duration you can invest, you may choose the course that is convenient for you all. So I would like to give you a summary or an introduction about the upcoming courses. So especially in Ayurveda cosmetology, which is a trending specialization in Ayurveda now, and which can give you a high income career. So we have a postgraduate diploma in Ayurveda cosmetology and trichology. We have diploma in Ayurveda cosmetology, and of course there are other courses like ABA. So we'll be mainly concentrating on the first two courses now. So postgraduate diploma in Ayurveda cosmetology and trichology, it's a 1-year course. So there will be live online classes and offline hands-on training, and it's only for BMS doctors, and it is affiliated with National Skill Development Program, and it's a certified course. So those who are interested in joining this course, kindly contact AyurvedaMap and make the best use of it. Also, we have a diploma in Ayurveda cosmetology, which is a 6 months course. So you will be learning about the fundamentals of skin and hair health, different remedies for aging and pigmentation, etc. So there is a particular syllabus which you will be following for this. Again, there will be online sessions as well as offline hands-on training, which is the center is Bangalore, and the admissions for the batch 2 of DAC, that is Diploma in Ayurveda cosmetology, is now open. So kindly make use of this opportunity and grab the opportunity as early as possible and join the course. And we have a new course which is Stanika Chikitsa in Stree Roga. So it's a 3 months course, and you'll be specializing in the local gynecological therapies. So it includes a lot of the modern as well as Ayurveda part. So as you can see, a few of the procedures are mentioned in the brochure. So Agni Karma, Kshara Karma, Yoni Varti, Yoni Prakshalana, etc. will be taught. There is also hands-on training which will be at SDM Udupi. So we currently have a early bird offer. So kindly make the best use of this opportunity and join the course. And we have Diploma in Ayurveda Cardiology course. It's a certified course in cardiac disorder management in Ayurveda. So with this, you become a cardiac specialist in Ayurveda. It's a new course, and again, we have an early bird offer for this course. So this is the, it's a 6 months online training program for BAMS doctors, which will be launching soon. And this is the syllabus of Diploma in Ayurveda Cardiology course. As you can see, there are a lot of different things that will be taught. So cardiac investigations, ECG interpretations, and different lifestyle therapeutic approaches, etc. will be taught in this course. Also, as an introductory webinar, we have a free session tomorrow, how to become a successful Ayurvedic cardiologist, which will be conducted by mentor Dr. Shyam Sundar Tarachand Kakani sir. So with this, you will get an introduction to the diploma in Ayurveda the cardiology course. Also, you will see what are the advantages of learning this course. Okay, tomorrow we have, that is January 15th, we have a free session. So kindly tell your friends and colleagues to make the best use of this opportunity and join the session to know more about the diploma in Ayurveda cardiology course. Also, we have professional diploma in orthopedics and sports medicine rehabilitation diploma. So it's a 6 months clinical specialization for Ayurveda doctors. So again, it's a certified course. And as you can see, why you have to choose this diploma. So those are interested in sports medicine and orthopedics can contact AyurvedaMap and grab this opportunity to join this course. We also have a diploma in antenatal and postnatal care in Ayurveda. So, different clinical therapies from Garbha Samskara to Sutika Paricharya with hands-on training will be taught in this course. Again, it's a 6 months course. It is a hybrid learning. There is online as well as offline teaching. So, it's again a certified course. So, limited seats are available and the course is launching soon. Kindly contact AyurvedaMap to join this course and make the best use of it. So these are the upcoming courses of AyurvedaMap, and kindly choose your field of interest in which you would like to specialize and make the best use of this opportunity that is being provided by AyurvedaMap. So contact AyurvedaMap at the earliest and join the courses. And there's one more. So we have a professional diploma in Ayurveda advanced Panchakarma course. So the admissions for 2026 is open. So it's a 6 months course. So everything about advanced Panchakarma courses will be taught in this course. So again, the teaching is hybrid teaching, online as well as offline. Hands-on training will be provided. So as you all know, most of the courses, the recorded videos will be provided. Post-course support will be provided. All your questions will be answered in the live sessions. And all faculties are very well-known faculties in these areas or their subjects. So kindly make the best use of these courses. Join the course as early as possible. So moving on to today's free webinar is on cosmetology, and the topic is Acanthosis nigricans. So it's more than just pigmentation. So it has metabolic and clinical relevance in Ayurveda, and we will understand what it is by our speaker, Dr. Anila Sethumadhavan. I welcome her for today's session, and she's completed her BAMS, and also she's specialized PGDAC, DCC, and FMC. She's also the co-founder of Secret Hues, and she's an expert in Ayurvedic cosmetology and skin disorders. She's also the faculty member of AyurvedaMap. I welcome you for today's session, and over to you.
Thank you, Dr. Akshita. So we will move on to the presentation. I hope I am audible.
You're audible.
Is the slide visible?
Yes, it's visible.
Okay. So just a second. Yeah, so today's topic is about Acanthosis nigricans. So in our classics, we don't get any straight references about Acanthosis nigricans, okay? Why? Because when it comes to an acne, you have a straight reference, right? You have something which is called as AyurvedaMap. You have that reference which is available in classics. When it comes to melasma or any kind of pigmented patches, definitely you have a reference which is called as Vyanga, right? So it is easy for you to correlate and you understand these things. But when it comes to Acanthosis nigricans, it's never stated as such, okay? But we can correlate and we can understand, okay? So that is the importance of this particular session. And I also want to know whether there are any doctors who are practicing cosmetology right now in this particular session. So Dr. Akshita, can you just let me know whether there are doctors practicing, cosmetology in this particular talk?
Yes, doctor. I will just allow the participants to unmute themselves so they
Yeah.
can, yeah. Dear participants, those who are practicing cosmetology, kindly unmute yourself, or you may also enter in the chat box. Those
Yeah,
are
yeah, please. You can enter in the chat box so that there won't be any confusions whenever we are giving the recordings. There won't be any confusion. So you
sure.
can mention in the chat box whether you are practicing or not. Why? Because acanthosis nigricans is a very common condition which we always get in the OPD. Okay. That is not like something which is very, it is just a condition. It is always something which is associated with a syndrome or with a, insulin resistance, obesity, etc. So why I asked you about this is like recently I had an opportunity to visit a school. Okay, it was an UP school. Okay, so that is students, below 8th standard will be there. Okay, so I just had an interaction with them, and what I just noticed is like most of the students, okay, most of the kids, they are having that blackishness. Okay, they are having that stubborn blackishness on the nape of the neck. Okay, and what I have noticed is like most of the kids are a little bit, into overweight. Okay, more into kind of obesity. Okay, so these things you always get in your OPD. So whenever they come with a problem of hyperpigmentation, when they come with a patch, small patch over here, most of the time it is males who come. They will be overweight definitely, and you can see skin tags and all in the neck, and sometimes you can see DPN. See, DPN is not directly connected with all these insulin resistance and all, but still I am telling you can see all these kind of things, and you can see that they will be overweight, and you can see this pigmentation. When you see this kind of pigmentation, stubborn pigmentation over the forehead, you have to ask them whether you are having any pigmentation over your nape of the neck or in your axilla and all that. That question should be asked. Definitely they will say yes. Okay. So this is what is acanthosis nigricans, because acanthosis nigricans is always associated with something. Okay. It is always a sign. Okay. Rather than considering it as a, particular skin disorder, you should always consider it as a sign. It is a warning sign of the body telling that there is some problem with your insulin, metabolism, or there is some problem with your body metabolism. You are going to have, you're having certain issues with your system. So that is what it is, a warning sign. Okay. So, doctor, is there someone who is practicing, doctor?
Yes, Dr. Afreen has she's replied. I am practicing more in weight management. Many
Very
patients with
good, very good, very good, Dr. Afri.
PCOS.
Yes, yes. Today we want to, see this session is not like why I asked you is like every time a session should not always be like from a speaker side. Okay, it should also be from the participant side also, because see, Dr. Afreen, she's concentrating on a area which is very unique. She's concentrating on the obesity management, right, Dr. Akshita?
She says weight management, and many patients with the PCOS have this issue.
Yes, yes.
And Dr. Atira Pratap, I am practicing. Okay,
Oh,
she's
good, good. Dr. Adira Pratap. Yes, I know her. So I'm very happy to know these things, because yes, Dr. Afreen, we'll have small discussions, because this acanthosis nigricans is associated with obesity. Okay, that you can see in kids basically. Okay, you can see in kids basically 6 year, 7 year old. They all come to the OPD with overweight and all. You can see that acanthosis nigricans. Okay, so now let's move on to the session, and we'll have small small discussions in between. Okay, so can I move on, doctor?
uh, one more Dr. Lakshmi Priya also says she's practicing.
Very
So
good. I know
yeah,
Dr. Lakshmi Priya. Okay,
we can
okay.
move on.
So we can move on. See, acanthosis nigricans is a cutaneous manifestation of an underlying condition, okay, which I have already stated. See, acanthosis nigricans is something, a cutaneous, you can say a cutaneous signal of an underlying condition. It usually develops in skin folds. It usually, I think most of the students are from North.
I think there is mixed
Okay.
participants.
Okay. So it usually develops in the skin folds such as back of the neck, axilla, and groin. Okay. So whenever the patient comes to your OPD and they complain about light darkishness in the neck and all, you just ask them about whether you are having blackishness in, I mean, dark hyperpigmentation in your axilla or groin, and you're having any, tags or something which is associated with it, then you can confirm, okay, this is Acanthosis nigricans, okay? Where it presents as a velvety, hyperpigmented patches with poorly defined borders. This is very important, okay? Where it presents as velvety, hyperpigmented patches with poorly defined borders. What do you mean by poorly defined borders? Because the borders won't be that visible. So it will be just diffusing into the other part of the skin, okay? It will be just diffusing. It will be not like, it will be just like a patch, okay? It will be just dissolving. Okay, it won't be having any particular border. Okay, so when it comes to a melasma patch, it will be having a particular border, right? You have seen for a melasma patch, it is having a particular border. It will be in the border itself. But for this Acanthosis nigricans, you can't see any borders. It will be diffused. Okay. Acanthosis nigricans is a dermatosis. So what do you mean by dermatosis? What does the term dermatosis denote? Dermatosis denotes any skin condition which is not what? Which is not associated with inflammation. It is called as dermatosis. What is dermatitis? When it is associated with a inflammation, you call it as a dermatitis. Okay. This is a dermatosis where there is no inflammation. This is characterized by velvety, papillomatous, black, brownish black, hyperkeratotic plates. What do you mean by papillomatous? You can see small warts like things, you can see tag like things, all these external, the way it presents is called what do you mean by papilla? Papilla means finger-like projections, right? So instead of finger-like projections, you can see small warts, you can see small tags. That is what it's meant by papillomatous. And it is brownish black in color, okay? And it is hyperkeratotic plaques. Okay, the keratinization is more, that is hyperkeratotic plaques. So that is why it will be hard. The skin will be hard to touch. Okay, typically on the intragenous surface and neck, because where it comes into contact, where two parts comes into contact, and it is also seen in the neck. Okay, although AN, that is Acanthosis nigricans, is associated with malignancy, the recognition of its more common connection to obesity and insulin resistance allows for diagnosis of related disorders, including type 2 diabetes, metabolic syndrome, and polycystic ovarian syndrome. So, like when we come into more into the types of Acanthosis nigricans, you can see there is a type of Acanthosis nigricans which is associated with the malignancy. Okay, but more common when you see in the OPD, you can see when it is associated, it is associated with the insulin resistance, it's associated with the metabolic syndrome, it is associated with the polycystic ovarian syndrome. As doctor has already stated, she told she had a patient, she had patients, she had seen conditions in which Acanthosis nigricans is present and the patient is having polycystic ovarian syndrome. Okay, and likewise you can see like type 2 diabetes patients which is presenting with Acanthosis nigricans. That is the reason why it is said like Acanthosis nigricans can't be actually considered as just as a skin condition. Okay, it is always accompanied by the underlying disorder. So when it comes to treatment, you always treat the disease, but it doesn't mean like you just leave the lesions like that. You give the medicines, but the thing is like you are not treating the underlying condition, this will come back. Okay, the lesion will come back. And early recognition of these conditions is essential for the prevention of the disease progression. Now, regarding the signs and symptoms, the lesion of Acanthosis nigricans typically occurs in the area of skin fold, as we have already said, like groin, axilla, posterior neck. In children, the most common site of Acanthosis nigricans is posterior neck. Have anyone seen? I had a patient, okay, she was a small girl. She was actually, I think, 7 years old, and she was around 50 to 60 kgs. She came to me with this Acanthosis nigricans, and that was present in the neck. And has anyone seen? Now, rare, so that is what it was associated with the obesity, because her food pattern was completely wrong, because it was during the COVID time. So she was sitting in the home, the online sessions was going on. There was no any activity for the kid, but the kid was only onto the fast food items. She never eats anything which is cooked at home. Okay. And she was obese. So next is rarely Acanthosis nigricans may occur on mucous membrane of the nose, oral cavity, esophagus, or larynx. Women may also develop the lesions on nipple. Rare cases of Acanthosis nigricans has been reported in the conjunctiva. Okay. In some patients, there also may be associated with skin tag in the same area. Okay. That is most common in the which area? Which area skin tags are most common? Since skin tags can be seen most common in the like axillary area and in the groin area. In that in some of the cases you can see tags over there also. Okay. Nail changes like hyperkeratosis and leukonychia may be present, and I'll show you the pics. Clinically, it is not possible to differentiate the lesions of benign versus malignant Acanthosis nigricans. So this is very important point. If at all an Acanthosis nigricans comes to you, you won't be able to differentiate whether the lesions are benign or malignant. But the thing is, like with the progression of the lesions, you can understand whether this is malignant or whether it is benign. Okay. While usually asymptomatic, Acanthosis nigricans is usually pruritic. That is very important. Okay, most of the cases it is like what? It is asymptomatic, but in some of the cases it is pruritic. That means it is what? What do you mean by pruritus? It is like associated with small irritation or itching. See, have you seen the pics, doctors? So this is hyperkeratosis. You can see the how it is in the nail, and you can see this one. Okay. Okay. See in the neck, you can see the patches. Okay. You can see the tags. See, most of the kids nowadays have these kind of lesions on their neck. Basically because of the food pattern. Okay. Most of the kids, whenever what is the interesting thing is like, in most of the cases, when you just let them know like their diet is wrong, you just modify with your diet itself, these regression can be seen in the patches. Okay, the patches resolves by itself because this is basically due to what? This is basically due to a faulty lifestyle. Most of the cases, I don't say in generally, but most of the cases which we get is basically because of these things only. Okay. Now coming to etiology. Now the etiology can be actually, grouped into these 4 types. That is metabolic causes is there, endocrine causes is there, malignancy is there, and genetic cause is there. Okay. That is metabolic means obesity, insulin resistant, type 2 diabetes, metabolic syndrome, polycystic ovarian syndrome, and when it comes to the endocrine, you can see these lesions in acromegaly, hypothyroidism, and Cushing's syndrome. That is the reason why we always take a thyroid profile. Okay, we always go for a thyroid profile when it comes to this Acanthosis nigricans. Okay, along with other blood tests, we also do that. Okay, malignancy is like especially adenocarcinoma of stomach, lung, or breast. Malignancy associated AN is often more widespread and resistant to the treatment. That is the important point. Whenever you are getting a case, you are doing everything, but you don't get any result, then definitely refer the case. Okay, don't go on experimenting. Okay, because when you are giving a healthy diet and when you are giving the medicines and so you're giving some external LAPAs and some scrubs and all, there will be certain amount of relapse of the disease. Okay, but you are not seeing that, and this kind of this is widespreading, like in most of the cases, like once after this groin area and all, it is moving on to the knuckles and all, it is just spreading in a fast mode. Then you keep a point like, okay, this we can't we can't control, so definitely do a referral. Okay, and then the next is genetic, rare familial syndromes with FGFR gene mutation. Okay, so what is the thing is like, every time you have to know when you have to refer the certain case, because most of the cases when it comes to cosmetology don't feel like it is a very safe place to be in, because many of the diseases, there might be some underlying cause like malignancy. So in that all case, we have to refer it. Okay, we have to refer at the earliest. So you should know by what span you should get the result. Okay, and if it is not, if you are not getting and the disease is spreading, then definitely refer. Okay, you tell the patient and definitely refer, and keep a record, like you just ask your those who are in the clinic to just call and follow up with what was the case. Okay. Next is pathophysiology. Okay, insulin resistance and hyperinsulinemia. Okay, the most common driver, the body produces excess insulin, which then cross reacts with IGF-1 receptors on skin cells, causing overgrowth. See, whenever you go for a blood test in the earlier stages, like you have this blackishness, but still you just go for the the blood test, the FBS and PPBS will remain normal. Why? Because the pancreas is working more and more, so that what it can take the whole, it can produce more insulin and just draw the whole from the glucose from the blood and give it to the cell. Okay, so that's why what it does, it just strains out itself. So in the beginning, the FBS and PPBS will be normal. And when it comes to HbA1c, you can see it in a pre-diabetic mode. Okay. So what you have to do, even though the patient will come and tell you, so this is normal, but just check the levels. It will be in the border. Okay. Okay. That will be in the pre-diabetic border. Okay. Now, growth factor signaling, that is insulin IGF-1 pathway. High insulin binds to IGF-1 receptors, stimulating keratinocyte and fibroblast proliferation, increasing the skin thickness and dermal papillae. There is dermal papillae. There is, what is dermal papillae? The dermal papillae, the dermis is having two layers, right? In that, the papillomatous thing will come inside to the epidermis. Okay, I'll show you the pic. Okay, epidermal growth factors or fibroblast growth factor pathways. That is overactivation of receptors of EGF. What is EGF? The epidermal growth factor or the fibroblast growth factor by various ligands. What do you mean by ligands? Molecules or genetic defects can also trigger the keratinocyte proliferation. The keratinocyte is seen in which layer, doctors? Keratinocyte is seen in which layer? Keratinocyte is seen in the epidermis, right? It is seen in the epidermis, right? So there will be what? Keratinocyte proliferation. Okay, that is why it is said as hyperkeratosis. Okay, so hyperkeratosis is because of this. Is the point clear? Dr. Akshata, have you received any this thing? Is the point clear?
Dr. Afreen sends a thumbs up. Okay, Dr. Maljeet Singh, yes, ma'am.
Okay, then we'll move on. Now, next is cellular proliferation. There is cellular proliferation, right? So this, what this results into what? Hyperkeratosis, the thickening of the stratum corneum, which is the outer layer. Papillomatosis, the elongation and thickening of the dermal papillae, finger-like projections into the epidermis. And what happens to the basal layer? What happens to the basal layer? Mild melanosis, that is melanin increase, and melanocytosis. What do you mean by the melanocytosis? That melanin containing cells are increasing in number. Okay, this contribute to the dark color along with the thickened stratum corneum. Okay, I hope the point is clear. In essence, Acanthosis nigricans reflects a dysregulated growth signal in the skin, often rooted in hyperinsulinemia, causing skin cells to multiply excessively and resulting in the characteristic velvety, hyperpigmented plaques, most prominently in skin fold. Okay? See the dermal papilla? Can you see the finger-like projections? Doctors, can you see? See, one arrow is there and it is showing you. Can you see, doctors? Is that clear? This is the... Okay. Now we move on to the types. What are the types of Acanthosis nigricans? So Acanthosis nigricans I have mentioned as AN. Okay. Obesity-associated Acanthosis nigricans. It was once labeled as pseudo-AN. Okay. Is the most common type of Acanthosis nigricans. Okay. Lesions may appear at any age, but are more common in adulthood. The dermatosis is weight dependent and lesions may completely regress with the weight reduction. Insulin resistance is often present in these patients. However, it is not universal. I had a friend, she was actually like overweight. Okay. And she did all those diet and she was going to gym and all those things, whatever she could do, but she never took any medicines. But she lost her she nicely lost her weight, and actually the whatever was there in the neck, it just disappeared as such. And then she started using some some face packs and all over the neck area, and now it is completely clear. Okay. And she's on a healthy diet. Okay. And next is syndromic Acanthosis nigricans is a name given to the Acanthosis nigricans that is associated with a syndrome. Okay. In addition to widely recognized association of Acanthosis nigricans with insulin resistance, Acanthosis nigricans has been associated with normal syndrome, numerous syndromes, right? Always when it is Acanthosis nigricans, what condition rhymes with it, as we can say, it is insulin resistance, right? Always it is like Acanthosis nigricans is equal to insulin resistance, right? So in certain cases, Acanthosis nigricans can also be associated with numerous syndromes. So let's see type A syndrome and type B syndrome. Okay. The type A syndrome is also termed as hyperandrogenemia, insulin resistant, and AN syndrome, hair syndrome. Have anyone heard about it? Dr. Afreen, you have seen this, right? I can't see your messages. So let's discuss in the last. This syndrome is often familial, affecting primary young women, especially Black women. It is associated with polycystic ovaries or signs of virilization. So that is why, see, it is this syndrome is often familiar. So that is the reason when a mother is having polycystic ovarian syndrome, if at all mother is having the problems with those things, we always keep an eye on the daughter's this thing. Menstrual cycle and menstrual health. We should always keep an eye on that. You should let the people know also. Okay, let the patient know also. You have to keep an eye on this. So you have to make her diet and make her lifestyle more healthy. Okay, because she is more prone to get this. Okay. It is associated with polycystic ovaries or signs of virilization. What is virilization? What is virilization? That is hirsutism and clitoral hypertrophy. High plasma testosterone levels are common. The lesions of AN may arise during infancy and progress rapidly during the puberty. Okay. Type B syndrome generally occurs in women who have uncontrolled diabetes mellitus, ovarian hyperandrogenism, or an autoimmune disease such as systemic lupus, scleroderma, and Sjögren's syndrome, and Hashimoto thyroiditis. Okay. Circulating antibodies to the insulin receptor may be present, and in these patients, lesions of AN are of varying severity. Okay. Acral AN, okay, which occurs in patient who are in otherwise good health. Okay, the patient will be in good health, but it is common in dark-skinned individuals, especially those of African American descent, and hyperkeratotic velvetic lesions are most prominent over the dorsal aspects of hands and feet. Okay, next is drug-induced AN. Okay, drug-induced AN is this cases you can get. Okay. Like I'll just share an experience. I had not in AN but in melasma. I had a patient, and the patient was telling me she was just 25 years and she was getting the melasma patches. I took the history. I was asking a lot of questions, but I could not find out what is actually triggering the thing. Okay, I need a hook on which I can just hold on and treat the case. But I was not getting the hook. I was just asking a lot of questions, and at the last I asked her, are you on any medication? Like I have asked her that before, like, are you on any medication? So she was like, no, doctor, I am not on any medication. So last I asked her, are you on any kind of, this thing like oral contraceptive? So she said, yes. Okay. She is most days she's on oral contraceptive. So that is the reason why she got this hyperpigmented melasma patch on her face. So similarly, when it comes to Acanthosis nigricans, whenever you can't get any hook, you just ask about whether they are using any oral contraceptives, okay, and any formula which is having fusidic acid, okay. You just ask any steroids they are using, okay, and you just ask these questions. These are the most common kind of drug abuse which we can see like once they use and they get the lesion. So if they're if you come to know, ask them to stop it. Okay, ask them to stop it, because nidana parivarjanam is the first line of treatment. That nidana parivarjanam is the chikitsa. Okay, although uncommon, maybe it's not that uncommon, this is common nowadays. Okay, maybe induced by several medications including nicotinic acid, insulin pituitary extract, and systemic corticosteroids, and rarely triazinate, oral contraceptives, fusidic acid, and methyl testosterone, and also have been associated with AN. Lesion of AN may regress following the discontinuation of the offending medication. Once you have stopped the medication, you can see these lesions regressing. Okay. Next is familial. This lesion typically begin during the early childhood, but may manifest at any age. Okay. Condition often progresses till puberty and then it stabilizes or it regresses. Okay. Next is mixed type. What is mixed type? That is refers to those situations in which a patient with one of the above types of AN develops new lesion of a different etiology. An example of this would be an overweight patient with obesity associated AN who subsequently develops malignant AN. That is two combination, right? The 2 or 3 combination of the similar, this thing can be seen. Okay. Next is malignant AN. Okay, malignant Acanthosis nigricans, which is associated with internal malignancy, is the most worrisome of the variants of Acanthosis nigricans because the underlying neoplasm is often an aggressive cancer. Okay, and that is the reason why the lesions spread very fast. Okay, it won't give you much time. Acanthosis nigricans has been reported with many kind of cancers, but by far the most common underlying malignancy is the adenocarcinoma of gastrointestinal origin, usually a gastric adenocarcinoma. Malignant Acanthosis nigricans is clinically indistinguishable from benign forms, as we have already discussed. However, one must be more suspicious if the lesions arise rapidly, are more extensive, are symptomatic, or are in atypical locations. Okay, like we have said about some locations where it should be, right? When it becomes into an aggressive form only, it will be seen in all those these things, as we have said, in conjunctiva, and this is knuckles and all dosum of the hand and foot. Okay, regression of Acanthosis nigricans has been seen with the treatment of the underlying malignancy, and reappearance may suggest recurrence or metastasis of the primary tumor. So next is the diagnosis. How do you diagnose this? Clinical examination is often sufficient. History taking to evaluate, that is very important. You ask when did you get this? How did you get this? For how long have you been noticing? Okay, you have to ask these things very like you should ask them again and again. Sometimes they won't say, but you just ask them again and again in different modes. You ask them. Okay. And onset and duration is very important, as I have already stated, and associated symptoms, whether there is a weight gain or endocrine disorder, or as it is stated, like whether there is any drug use. Okay, there's oral contraceptives and steroids. Keep in mind, you always have to ask these things to the patient. They will just tell you a name. I am using this tablet. Okay, just look into what kind of tablet it is. Okay, or ask them to bring the strips with them. Okay. Then investigations, as I already stated, blood glucose, HbA1c, lipid profile is very important, and thyroid function test is very important. You can see in the lipid profile, triglycerides will be high, insulin levels, and if a typical onset, check for malignancy. Now, what is a preventive measure? As we all know, it is always into a healthy weight and diet, right? And manage insulin resistance through lifestyle. That is very important. When it comes to PCOS patient, you have to tell them always follow the healthy diet and healthy this thing. Once they are skipping again, coming back to their whatever, the wrong food type and lifestyle, they're definitely going to get it back. Okay. No matter they're taking the medicines, but they'll get it. Okay. So you have to tell them, like always, you have to stick on to a healthy routine. Okay, regular screening in patients with PCOS or metabolic syndrome. Always you have to tell the patients with the PCOS, if at all they have stopped the medicine. Okay, we just give the medicines for the corrections, right? After the corrections, once we stop the medicine also, you tell them, you always stick on to the pathyas, which I have given you. Okay, you always stick on to the pathyas. Once in a while, it is okay. Again, you just jump back into the normal this thing. Okay, because nowadays, like when it comes to cities and all, there is a type of culture which is happening, like, the culture of, the party culture, and which is happening. So once in a while it is okay, but after that you just jump back to your normal diet. Okay, and avoid long-term use of causative drugs if alternative exists. But what is very important is, like, when you talk to patient about pathya, don't say the word pathya. When you say the word pathya, they have the tendency to break it. Okay, you tell them, I'll get you some, some Ayurvedic way of dieting techniques. Okay, you have to present it like that. Okay, so Ayurvedic, it's another, it's something in a quotation. Wow, it's attractive. And diet, again, it is attractive. So they will be okay, because nowadays someone on diet is seen as a, as a hero or something like that, right? Oh, you are on a diet. Oh, he's so health conscious. That is the way people are, seeing them. So definitely tell them this is the Ayurvedic diet. This is not Pathya. This is Ayurvedic diet. When you say it is Ayurvedic diet, definitely they will follow. If you say the word Pathya, they will be saying, no, doctor, I can't look all these Pathyas. Okay. So be little bit, crooked. Okay. When it comes dealing with the patients. Some of the patients, they'll be okay. Okay, fine, doctor, I'll deal with all these Pathyas and I'll follow everything. But some patients will be like, okay, you're giving me Pathya, then okay, let me think. So you will understand the patient. Like once you talk to the patient to 10 to 5 minutes, you can understand like, okay, what kind of person he is or what kind of person she is. So accordingly, you present whatever, tools is there. Because for an Ayurveda physician, the tool is like one is yoga, another is healthy lifestyle. Next is our medicine. So you have to keep this thing very, in a very nice manner. Like they should accept it. Okay. Rather than denying it, they should accept it. When a patient comes to me, they comes for the external applications. As you all know, we have a brand. So definitely they come for suggestion with the medicines. So, I mean, external things. So when I see, like, when I just go through the case and I find like, okay, there is some internal correction is needed, I put it in such a way that they can't even, say no. I'll tell them, okay, this will go with the external application. But if at all you're taking an internal, this thing, the result will be a little more, fast. And your internal detox is going to happen. And that word is also very important, detox. People are really, crazy about the word detox. So you can also cling on to the term detox. Okay. So these are the things where you can just hold on and you can just present your thing. Okay. So you have to be very wise when it comes to cosmetology. The patients which is coming to you might not be a new one. They will have gone to all the places and they'll have to come last to you. Okay. So they will be having a lot of informations and they will ask you whether you have any Pathya. So you tell, no, I don't have any Pathya. I just have, Ayurvedic diet and, Ayurvedic medicines, which is really good for your health. So that's what I just mentioned. I don't have any Pathya. Okay. So once you just avoid the Pathya itself, they'll be happy to follow you. Okay. But you give Pathya, but in this manner. Okay. You always put some, once you are putting forward a thing, just make it a point that you, put butter and you put honey and you garnish it very well and you put it in front of the patient. Okay. Because most of the cases, when they go to any dermatologist or when they go to any cosmetology clinics, what they do is they'll tell, okay, we will do that microdermabrasion, we will do that chemical peeling. You don't have to take anything inside. They'll just give a hormonal tablet if at all it is a hormonal thing. So this is easy for the patient. Okay, they are not going to tell the patient, don't eat this, don't eat that, don't do this. They're not going to tell that. They're just going to tell you should stick on to a healthy lifestyle. What is a healthy lifestyle? Even they don't bother to tell them. Okay, so most of our, Pathyas and most of our combinations, they don't know about it. So they won't mention about it. So for the patient, it is very easy. But when it comes as we say, don't eat that fermented food, don't eat this, don't eat that we have a lot of things. So instead, don't go for more don'ts, go for more do's and tell them, see, whatever I am going to mention, these are not that healthy. Then they will be okay. So I think that point of Pathya is very clear to you how to present. That is very important, doctors. So now moving on to the modern approach, how they see such kind of things: treat underlying cause, weight loss, dietary modification, control of blood sugar and insulin resistance, discontinuing the medications triggering AN. Definitely. And topical treatments, like you can see retinoids, retinol, exfoliating effects. Have you ever heard of retinoids in any other cosmetological cases it's been used? Dr. Akshada, do we have any answers in the chat box?
Dr. Afreen says acne.
Yes, very good, Dr. Afreen. We use in retinoids in this acne because for the exfoliating purpose. Very good. And hydroquinone or kojic acid. Hydroquinone, we have seen the triple formula and all. It is hydroquinone is present for the pigmentation. Okay, for melasma, all kind of pigmentations, we can give these things. Okay, we can give. We have seen doctors giving. Okay. And procedural options, laser therapy, chemical fields, and you can go for this microdermabrasion. This is just, what exfoliation. Okay. So what we can do externally, definitely we are going to give internal medicines. Okay. We are going to give internal medicines. That is something which we have to keep it aside. Okay. So always understand, when a patient walks into your OP, you are sitting in a clinic and she or she is walking into an OP with a cosmetological issue, he or she will be expecting something externally. Okay, something he or she will be expecting externally, and 90% of the patients feel actually disheartened when you don't give anything for them for the external application. Okay, if you're not giving anything for external application, you're telling it's okay, you just have a healthy diet, you do all these exercises, you drink all these kashayas, you take all these tablets, and you do all these things, you will be okay, means see his heart or her heart will be actually, they'll be so feeling so irritated. Why? Because they have come for something from you. Okay, so what you can do, you can give some mild scrubbing with Varnegana drugs or Triphala Churna. You can mix it with curd or something, and you can give for small mild scrubbing, and then you can give that lepana with Varnegana with the curd, or milk for the lightening aspect. You can apply aloe vera gel, no problem. See, these all things you can give externally, they'll be very happy. They'll be very happy to do. And don't think like men will never do. Nowadays, I get more men patients in my OP, and they are very cautious about their skin. And I am in this Malappuram, Calicut area, and now also most of the women are earning, but still there is a men have always have that freedom to purchase all these things. Okay, so they'll be coming to you with a 20 of creams and all those 3 to 4 sunscreen and 4 to 5 scrubs, all those cleansers. They'll be having mild cleansers, they'll be having foaming cleansers, they'll be having uh, all type of thing. They'll be having serums. So there will be some pharma products which that doctor has prescribed. Then he will go to this doctor. That also, he or she will be also giving some medicine. So he or she is going to come with all the products. So when you are sitting in a cosmetic OP, make a point that you know what is going in the mark, I mean in the Instagram. Okay, basically that is a trending thing. Okay, just know about different combinations, have just an idea about different combinations, so that when you just turn back and see, you can tell them, okay, this product won't suit your skin because of this, or this product is okay for your skin because of this you should be able to tell. And don't think that these people are ignorant. They have read everything and then only they come. Something which is very important with males who are very particular about the skin is they will be having more knowledge when it comes, they'll be having more knowledge about what they are using when it compared to women. Women use it everything very perfectly, but that too much they won't be thinking about. But this men, when they come with any product, they have keep it that thing in mind, like he knows A to Z about that product. Okay, so you can just blah blah, you can't say like that. You should be very pinpoint. Okay, you tell them this is not okay for your skin because your skin is this type and this particular thing is present in the skin, so this won't suit you. So you should tell them, oh, you're using it in the morning, actually this product is to be used in the night because of this particular ingredients. Tell me, doctors, if there is retinoids in the cream or gel or in the serum, when should a person use it, in the morning or in the night? Tell me, doctors.
There are two answers which says night.
Very good. Definitely. Why we use this thing in the night? Because it is photosensitive, right? And also another thing is like we just keep it for very little time. Okay, first of all, when we give the retinoids, see, when someone is purchasing retinoid serum from the market and just applying it on the skin, you have to be very cautious. When it is retinoid serums, you just apply for half an hour and see whether it is suiting your skin. Then only just wash it off and just wait for another day, 2 days, and see whether there is much peeling and all. If there is much peeling, redness and all, you shouldn't use that particular product. Okay, and if at all peeling and redness is there, you should use a very good sunscreen before going out to the sun. Okay, these things and everything you should actually you should convey this to the patient. Dermatologists, they don't have the time to convey all these informations. Why? They are just concentrating on the procedures. Okay, if the patient is having a skin tag and the patient is asking, why I am you come, you just lay down here, let me do the cottering. Okay, because they don't have time. There is a long line back. Okay, but even though you are having a long line means in your OP, you should tell these things very clearly, because patient education is very important. If you don't educate your patient, today he will come to you, tomorrow he will go to some others and he will tell, okay, one doctor called this, then this was sitting in this particular area with in the name of this particular clinic. She knows nothing or he knows nothing. He has given all these medicine and it's not working. Okay, these people don't wait for a long, but if they have to wait for long, they have to trust you. If they have to trust you, you should let them know every single thing in detail. Okay, I hope the point is very clear to you. Prognosis, benign Acanthosis nigricans has a good prognosis with treatment of underlying conditions. Drug-induced Acanthosis nigricans resolves with withdrawal of the drug. Malignant Acanthosis nigricans may indicate advanced internal cancer and has poor prognosis. Cosmetic improvement may be slow and requires consistency. That is what I have said. Now let's move on to the Ayurvedic perspective. Dosha perspective, there is hyperpigmentation and there is hyperkeratosis with the pruritus. So it is always a Vada Kapha. And when it is a skin disorder, we can always bring it under the umbrella of Kushta, right? So there will be always a Pitta involved in this. There will be always Pitta vitiation involved in this. Okay, so keep that Pitta in mind, then only you give the medicine. Okay, the hyperpigmentation, hyperkeratosis, pruritus can be considered as Vada Kapha predominant Kushta. So this is a Kushta Purvarupa. Okay, so in this we'll just pick on certain points which is very important when it comes to the perspective of Acanthosis nigricans. Okay. So these premonitory symptoms of Kushta points towards the symptoms of AN, which is Adhikara Sparsham. What does that mean? The hardness, right? And Vivarnada, that is the discoloration. Kandu, we have said in some of the cases there will be pruritus, and this Twaji Saba, that is Swaba, that is numbness, and the Sparshaknyato means there is touch is not. So this comes into when so and Acanthosis nigricans is considered as cutaneous markers of diabetes mellitus. Okay, Ega Kushta, Malse Shagalobamam, and Charma Kushta, Hasti Charma. These are the some of the correlations which we can bring into the into the Acanthosis nigricans. Okay, that is Malse Shagalam. What is the peculiarity of Malse Shagalam? It will be little bit it will be little bit hard, like it will be flaky, right? And it will be a little bit what you say, that small this thing will be there, and it will be a little bit raised, right? So, but in this, when it comes to our, this thing, lesions, it is not raised, but you can just consider the papilloma, as we have said, the papillomatous lesions, like tags or warts, that we can actually correlate in that area, because direct correlation of Acanthosis nigricans is not available in the text. Okay. So, Staulia, Medaroga, Prameha, and Kushta. See, it is always associated with Medaroga, right? And it is associated with the Prameha. It is associated with Staulia and Kushta, right? So what is the correlation we can bring into it? Acanthosis nigricans is with obesity, predictor of future of diabetes mellitus. And Prameha is due to the contamination of Medovaha Srodhas. Excessive accumulation of Medas will lead to Staulia, obesity, and Medoroga diseases caused due to the errors of the fat metabolism. Both Ayurveda and modern medicine agree on the interrelationship between the obesity and diabetes. So Chigilsa, that is Nidana Parivarjana, and so the Guru Snigdha Madhurahara, sedentary lifestyle, stress and hormonal imbalance is very important. So what all we can do in this case, we can do Udvartana, Tribala Churna with Tribala Churna or Kolagulatadi Churna, Abhinga you can do with Nalpamaradi Taila or Eladi Taila, and Svedana can be done, and Vamana, Virejana, Vasti, all these things we can do in the Acanthosis nigricans according to the underlying this thing. Okay, what is triggering? Okay. So these are some of the drug of choices I have just mentioned. Tiktagam Kashayam, Mahatiktagam Kashayam, Varanadi Kashayam, Uguluritam Kashayam, Aragudadi Kashayam, Padola Kadarohinyadi, Varadi Kashayam, Nisha Kadagadi Kashayam, Mahamanjishtadi, Danandaram Grudam, Tiktagam Grudam, Mahatiktagam Grudam, Varanadi Grudam, Gugulurita Grudam, Nava Gugulu, and Trubala. These are the some of the drugs which you can use. Okay. So by this we have end of the particular topic. This topic is very small, and this is because as it is associated with a lot of conditions. So okay, so just a second. Just a second. Yes. Very good. Afreen, I've given the answer. Very good, doctor. Very good. So by this, we are coming to the end of that particular session. And so we can move on to the discussion part. As this session, what I would have, I just want to tell you once again, when it comes to Acanthosis nigricans, it's not like any other this thing. You have to always be very particular about what is the underlying disorder. Then only you treat. So accordingly, the treatments will change. Okay. So always keep an eye on whatever medicines you have given. And you said how many of you are practicing? It is said, doctor, 2 of them.
Two of them have replied. I think two, three have replied. Yeah, Athira, Dr. Afreen, Dr. Athira, Dr. Lakshmi Priya. Yes.
Okay. Okay, doctor. When it comes to blood test, we have already said you have to go for the thyroid function test. You have to go for the FBS and PPBS. You have to go for the the lipid profile. Okay. Local application, doctor, you can give Triphala Churna, you can give small scrubbing, you can give to the children, no problem. Small scrubbing you can give so that color, it will lighten a little bit. But still, if the weight is not managed internally, there will be problems. And Varnyagana, you can make it into a powder, you can apply on the external application. As an external application, you can mix Navara if you want, okay, for the lightening. But keep in mind that you always do mild scrubbing. Like in a week, twice or thrice, you are doing a mild scrubbing. Keep in mind, it is a mild scrubbing, not more. Okay, once it starts lightening, you decrease the scrubbing frequency to once in a week and apply this LEPA continuously and give internal correction so that it will come to normal.
I'll read out the questions for you, Dr. Rai. Okay, I think we completed the uh, blood tests and obese AN.
Some
Okay.
Ayurvedic formulation to improve the insulin
Insulin
resistance
resistance.
diabetic patients.
Yeah.
Yeah, you can give that Maradi Kashayam, you can give Aranadi Kashayam, you can give this thing Arebudadi Kashayam. That is very best medicine. Okay, you can give Arebudadi Kashayam.
I think, Doctor, I will just once again remind them about the courses before we continue with the discussion so that, before participants leave the webinar, I would want to just remind. And I think Dr. Shweta N has raised her hand. Kindly hold on. I will just uh, give you a replay of the upcoming courses and then we will continue with the discussion. Thank you, Dr. Anila, for giving me this. Uh, Moment to share. Okay, among the different courses, I would like to talk about Diploma in Ayurveda Cosmetology course, which is an upcoming course. The batch 2 admissions are open. So, little bit about this course. So, the course features are it's 6 months duration course. BMS graduates can apply for this course, and the offline training center will be at Bengaluru. So, it has both online and offline, but the hands-on training will be at Bengaluru, and the university affiliated certification is provided. So, it's a highly specialized diploma program. It's just designed for BMS doctors to master skin and hair care, trichology, dermatology, and Ayurveda based beauty therapies. And with this, you can get high earning career and job business opportunities. So it is at different international and national level. You will have job opportunities after joining this diploma course. And so what few of the opportunities after completing the courses, you can go into jobs, that is clinical practice and wellness. You may also start your own cosmetology setup, entrepreneurship and product development, Ayurveda beauty. You can become a Ayurveda beauty consultant. So, which is again, it's a very trending and high paying job currently. And this is the just I would like to run through the syllabus of diploma in Ayurveda cosmetology. So everything about skin layers in detail will be dealt. So according to Ayurveda, and even the modern part, basics of Ayurveda cosmetology, Ritucharya, common skincare ingredients, and then basics of Dravya Guna and formulations. And also we have common dermatological conditions and OP management. So that is regarding, we have modules for it, management of cosmetological issues, OP level. So all this will be taught, and also formulations in cosmetology, different kalpanas will be taught. Trichology will be dealt in detail. And the parasurgical procedures that are used in cosmetology, Agni Karma, Shara Karma, and also Jaluka, Panchakarma and cosmetology. So that is about apart, there's one module which deals with face yoga. So practical 5 days offline session in Bengaluru will be there. So that is regarding the Diploma in Ayurveda Cosmetology course. Kindly contact AyurvedaMap to register to this course as soon as possible. And just a reminder about tomorrow's free orientation program, which we have for the Ayurveda Cardiology course. Sorry. Yes, just a quick run through about the upcoming courses. So Ayurveda Cosmetology, we have postgraduate diploma in Ayurveda Cosmetology and Trichology and diploma in Ayurveda Cosmetology, which is a 1 month, 1 year and 6 months course respectively. And we have Stanika Chikitsa and Stree Roga, a 3 months course. So currently we have early bird offer on the fee, and we have a diploma in Ayurveda Cardiology certified course. So this is the syllabus, and tomorrow we have a free session, how to become a successful Ayurveda cardiologist. Don't forget to register and join the free session. And professional diploma in orthopedics and sports medicine rehabilitation, diploma in antenatal and postnatal care in Ayurveda, and advanced Panchakarma professional diploma. These are the upcoming courses. So thank you so much, Doctor, for giving me the space to just run through the courses. So now we will take up the questions. I think Dr. Shweta has been waiting. So you may unmute yourself and ask your question, Dr. Shweta.
Hello. Hi. Am I audible?
Yes, you're audible.
You're audible.
Yes. Hi, Doctor. It was a very good class. Actually, my doubt is that it's my sister. Actually, she's having this pigmentation in her underarms since very small, around 12 years and all. So it was not very prominent. As years passed, it became very dark, and now it is very much pigmented. And it is not velvety. Her skin is very very thin, and at sometimes she feels painful while shaving or waxing and all. And she's having PCOD in right since 2020. Now she's 27 years. Her thyroid profile is normal. Her HbA1c was around 4 to 5. Then PPBS, FBS, everything is normal. Lipid profile was normal. No issues in that case. Sometimes she feels itching over the underarms, but not in a regular basis. Once in a while, sometimes. So how can we take up this?
Can I just intervene in between? So
Yeah,
is she doing this waxing for like what is the frequency she's doing the waxing?
No, just once she tried waxing because shaving irritates her skin. So just once she tried waxing, but it was not good. She was having painful.
Because
Then
she
she
was
went
having
for
that sensitivity, right?
yes.
Okay,
Yes,
okay,
then she went for laser treatment also, hair laser, so that pain irritation will not be there. But after that treatment also, one treatment also, she was having severe pain for 2 3 days.
Now, what about the sensitivity of the treatment, doctor? Already, her sensitivity was high, but when it comes to the hair removal, actually, in the lasers, what we have seen is like after the hair removal, there is a complication. The complication is more darkening of that area. Was that happened to her?
Yes, that happened. Yes.
Yes. So what you can do is basically you can, as this is very sensitive, just look into, just give small, you can give small packs over that area. Okay.
Okay.
Mind that should not irritate her. Okay.
Okay.
And you can use any you can use this aloe vera gel, no problem, but don't keep it long. Okay. Just keep it for 10 to 15 minutes and then just remove. Okay. And then check with her PCOS, like whether it has regressed or not. Still, she's having that pattern.
Yes, actually, in 2020, she was having PCOD in both. Then last year, it was normal. No signs. There was no PCOS or PCOD in scanning or symptoms. She's very thin, lean, not obese, not overweight also, not obese, not overweight also.
That
She
is
was
the
working.
most difficult PCOS to treat actually when it comes to a lean patient, right?
Yes.
Ask her to always have do yoga. Okay, ask her
Yeah.
to do yoga. Ask her to do that particular postures like Surya Namaskar. Ask her to do at least 12,
Mm.
12 times a day. Hmm?
Yeah.
And just check with the pigmentation over this area and use mild packs over that area. Okay, with milk
Okay.
you put, don't with, not with curd, you put with milk. Okay,
Okay.
then
Okay.
just check into it and just keep in mind like whether these kind of menstrual disorders was there in anyone in the family, not like your mother, like in your mother's family, anyone is having, not like this
Okay.
generation, just
Okay. Okay.
your mother clan and all. If it is like
Yeah.
that, there is a chance of this familial, this PCOS to be in a familial line. Okay. If it
Okay.
is in
Okay.
that line, she is actually, that is actually a high risk case. Okay. So always
Okay.
tell her to, go on a healthy diet and on a healthy
Okay.
routine and
Okay.
like just check on to her PCOS also. Like now she's just
Okay.
having a mild one or a left ovary, right?
Right. Right. Yes.
Like she's
Very
on
light. Yes. Yes.
medications right now, na?
No. No. She's not having anything. She's just
Had
handling
our
with her
kashayam, she
diet.
had our Thylams and all, she had something like that.
Before she had Sugumaram, in 2020 only she had medicines for that. After that, she just controlled with the diet, exercise, workout.
But
That
start
much
with the
only.
medicines, doctor. If that
Okay.
pigmentation has become so stubborn, start with the medicines for
Okay.
the PCOS. Okay.
Okay. Okay. So far, what can we give for the first line actually?
First, like you can start with the small Nirgundia Kashaya kind of things you can just start with. Okay. And
Okay.
her
Okay.
this periods, everything is normal, right? The
Yes.
cycle,
Yes. Yes.
there is
Yes.
no
Sight is normal, but she's having spotting for the
okay,
2 days.
spotting. If
Two
she's
days
having
bleeding.
spotting, then it is not cleared at all.
Okay. Okay.
Okay, that you have to be very careful. Okay, if she's having
Okay.
spotting, then give him that Hinguvajadi Churna and all. You give that thing and just start with the treatment and this thing. Okay, don't stop the medicines. Okay, unless
Okay.
and until
Okay.
it is resolved, don't stop with the medicines. But be very cautious. Like when the patient is very lean,
Okay.
you should not hamper with the bala of the patient. The medicine should not hamper with the bala of the patient. Okay, that is
Yes. Yes.
important. Keep in
Okay.
mind. Okay, okay, doctor.
Okay. So we can start with Nirgundyadi Kashayam,
Yes,
right?
yes. You can start with Nirgunya just for 1 week. You just start and see. Okay. And Hinguvajadi
Okay.
Churna, only that you give. Okay.
Okay. Okay.
As Thylams
Okay.
and all, we can plan. Okay.
Okay.
Hmm?
Okay, doctor. Okay. Thank you. Okay.
Her medicine, her food is on correct this thing, no? Regular, no? She's not,
Yes. Yes.
no. And
No.
stress is there. Stress is there.
Stress. Yes. Not very much, but she's kind of overthinking.
Okay.
Uh,
Then ask
only
her to,
after.
yeah, ask her to control her stress. Okay.
Okay. Okay. Sure. Okay.
That is also a triggering factor. Ask her to control it. Okay.
Okay. Okay. Okay, doctor. Okay.
Thank
Okay.
you.
Thank you. Thank
Thank
you.
you. Thank you, Dr. Shweta. We'll move on to the next question.
What
Uh, what
have you?
about external application for hirsutism? I think.
Doctor, I have not seen any, result with the external applications for hirsutism. Nothing is going to work. Nothing has worked. I have not seen. Okay, that's my experience. I don't know whether anyone is having any other experience. We had made that oil with haridala and all. We have given to the patient. We have applied. We just. I didn't get any much that much result. And what I would say is like the hormones. It should come and it should come to the normal level. Okay, then only we'll be getting. And then I have seen doctors telling patients to just go for mild waxing and then go for turmeric applications, but I have not seen any result in all those cases. Okay, so
Okay.
this I have not seen any results. And Dr. Afreen Pathan has given a question 2-3 turmeric trafala with milk. What is that, doctor?
Spoons, I guess. I'm guessing 2, 3 spoons. It must be spoons. Dr.
Turmeric and
Afreen,
tribala with milk
doc,
internally.
internally, that's what 2 to 3 times a week. Okay, she has messaged.
2 to 3
Uh,
times a week. What we have to give? Triphala,
okay.
she's asking. That is good. That is good. That is, I
Or
think she's
scrub.
asking
Okay.
about the scrubbing. No, she's asking
Yeah,
about
she's
the
asking
scrubbing.
about
Yeah.
the
In
scrub.
the beginning, doctor, in the beginning, just to give 2 to 3 times. After that, what happens is like once we are continuously disturbing the skin, no, there will be redness and irritation and all. For that, you just control and just ask the patient about the how he or she is feeling, whether it is okay and all. Then you just go with the frequency you have to just discontinue. Like sometimes mostly what I do is like 2 to 3 times I'll give and all these things I'll give. That time the patient will be very happy. Oh, I'm getting little bit results. But always convey the patient like once you stop the internal medicine, this is going to come without completely curing, it's going to come back. So this is just a symptomatic relief. You tell them, because this symptomatic relief is very important for the patient. Okay. Then after 1 week, then you tell, you just look into the case, and you can just either you can decrease the time span you are doing, or else you can decrease the frequency. That is up to you. Okay.
Thank you, doctor. I hope your question has been answered, Dr. Afreen. Next question, what
Patent ointments.
patent ointments for acanthosis? Yeah.
I didn't apply any patent ointment for
Mhm.
Acanthosis nigricans. I just use my Detan pack, which is a Varnagana, which is fortified with a Trufala and all. So I just use that, and I get results with that. And patent ointments, I don't know. You can just try with pigmento and all. Okay, I haven't tried, as the product is there. I haven't tried, doctor. So
Okay.
next.
So we have feedback from Dr. Elizabeth, very informative. Thank you, doctor. Thank you. Dr. Ashwati says valuable session. Thank you, doctor. Thank you, Dr. Ashwati. Next question, what will be given in hyperpigmentation on face conditions?
Hyperpigmentation on face condition, doctor. Hyperpigmentation on face conditions means it depends whether it is a post-inflammatory hyperpigmentation or whether it is a melasma. It differs. Okay. So basically, you can give this for external. You can give this Varnagana, this thing, and you can give Nalpamaradi Kashaya. You can give Kungumadi. You can give Kungumadi Nasya. All these things you can give, and you can give some saffron-based, gels or something for external applications, or serums for external applications. Okay. Next question is like, is glycolic acid useful for Acanthosis nigricans? Glycolic acid is useful for Acanthosis nigricans. Sorry, I don't know about the concentration, doctor. And please do suggest some. I can just go through and I can just let you know. What the preparations to manage insulin resistance. For insulin resistance, we can use that Navaga Gugulu and all these things. And you can use Triphala Churna. That is best. Okay. And Loma Shadanam oil have any effect on citizen, doctor? I haven't seen, doctor. So I can't actually tell you whether it is helpful or not. I haven't seen any results in all these things. Okay. So I whenever patient asks me also, I am like, doctor, I don't give them any this thing like, okay, this will come, this regress with the any Ayurvedic applications and all, because most of the time when I have given the Lomala Shadana Taila, I have seen pimples coming out, and then I have to treat for the pimple. Okay, so I didn't give anything. Okay. Already has stated, these lasers are having a complication. The complication is redness and blackening of that area. Okay, wherever you are using. And I have recently met a doctor. She's a doctor. She's an Ayurveda doctor. And so I talked to her and I asked her what happened to this area. It was very dark and was having this, very thick hair. So she told me like she had 6 sessions of lasers, and after that she had that blackish discoloration, and now the hair is bit more thicker than what she had. So I don't know what has happened. I have never seen such a like hair becoming more thicker, but I have seen this blackish discoloration in many of the cases who have gone for this removal.
Thank you. Next question. Cypress rotundus oil for hair removal or decreasing hair growth is trending on internet right now. Can you add on this?
Doctor, I have no idea about it. Definitely, I will just go and refer and let you know about the Cypress rotundus for the hair removal. I'm just, that's a big new information for me. Definitely, I'll just go through. And basically, I don't believe any oil is going to help for the hair removal. Okay. Basically, okay, that is just application of an oil and it's becoming thin. I don't think it is possible unless and until you have that internal correction. Okay. And the next question is like...
melasma is curable completely.
Melasma is curable completely when it is something which is having a long run, like 10 to 20 year, they are having such a long time.
Chronic.
And when they have used a certain triple formula and all, it is really difficult for you to cure that particular thing. But what you can, say, offer the patient is like, see, as our products are basically onto hyperpigmentation, I always get this kind of inquiry from the patients. So what I tell them is very simple. See, you are having a patch. So what I can do is like, I can reduce the darkness of the patch. And also the lesions will get lighter. Yesterday I had posted something in my WhatsApp status. Okay, that was like a patient came to me. She had used the triple formula for more than 1 year. Okay, so that is hydroquinone plus retinol plus a steroid. That is a triple formula. So she don't know what she had used, but she used it for 1 year, and she had damaged all her skin. And she came to me. She was not using a sunscreen. Okay, and after 4 months of treatment, actually, I didn't do anything externally. Okay, I just gave medicines internally. Just Mahatiktakagridam, Mahatitangashyam, Videjanam, and Haridragandam, all those medicines which you can see, very simple medicines which I have given. And I have given her our products, that is our saffron infused skin elixir oil and one Leba for external application. Okay, that is there. That D10 pack, which I have already mentioned. Okay, that instead of D10 pack, if you're giving, you can give the Varnagana. Okay, mix it with milk and apply, that you can say. And once you are removing, you just give a mild scrub and remove. This is what I have said her. And I have given her this medicine. And I have asked her to, not to go for this apatya things. And I have asked her not to go for any, any fermented food and whatever it's seen in the bakery or whatever you get it from a cafe. And don't go for that Dolikos lab. What do you call that? Kulatta, right? So don't go for such kind of, because we make it into a small this thing and we eat. So I told her, don't eat such kind of things. You just stay away. No fish and nothing, and no spices, nothing. So, and she's a very good patient. She's very, very patient, and she was sticking on to the diet. And yesterday I have posted that pic in my status. I was so happy. I could see the regression of the lesion. Like she had a lesion on the side of her temple, like in the temple region she had. And actually in the center portion, the lesion has completely whitened, like the skin, the normal skin has come, and the both lesion has, it has lightened. Okay, not to somewhat, but I would say it is more than 50%. Okay, more than 50%, because normally we don't get result in a triple formula. We do that too for 1 year she has used. Normally we don't get that result, but in a melasma patient I have got that result. Okay, and lesions is lighter somewhat. Is there any Resa medicines for vitiligo? I mean, which best internal? No, doctor, I haven't got any result with vitiligo. Okay, being very frank enough, I haven't got any result with vitiligo. So I can't tell you any medicines as such. Okay. Yeah, so lesions we can lighten, doctor. Who have asked that? Vivo V2427. Okay.
Okay. Any further questions? How to start?
Retinoids for anti-aging process purpose. See, retinoids, it is important, like how you use the retinoids in the formula, whether it is into as a serum, or whether it is as a cream, or whether you use as a, in whatever form you are using. Okay, in whatever form you are using, you keep in mind retinoids is not going to work similar for every skin. Okay, those who are sensitive, it is going to give you flakiness, it is going to give you all the reddishness, it is going to give you itching, everything, every problem it's going to give you. I have seen a girl who came to me, and she's just that is something which is very important when you comes to the cosmetology. There are people, Instagram influencers, who are coming and they are, advocating using pharma drugs. You use retinoid, you use this, you use that. You should not actually use pharma drugs as such. Okay, because there is a particular duration where you have to take. Always, I tell my patients to take a break in between the usage of the medicines. If at all there is retinoids, if at all there is no retinoids, because retinoids are something which is very, very, that is very irritant actually. So when you are using for the anti-aging purpose, the ratio will be very less in that particular cream or serum. And then what you have to keep in mind is like, you just use it very little quantity. Just take a pea size, just apply on the skin and just leave it for half an hour. Then just wash it off and just see next day how your skin is. So when you are using retinoids daily on a daily this thing on your skin, please make it sure that you are using a very good sunscreen, because you are peeling off your skin without knowing. Okay, you're peeling off your skin without knowing. So I always tell my patients, those who are, there are some patients who are very particular to use retinoids because they feel like their skin becomes red, their skin becomes like a Kashmiri apple. Okay, that is a particular term they use. when it comes to retinoids. Okay. But what is very important is like you just use a very good sunscreens after the next day morning. And when it comes to retinoids, what I say for the night is like you use it alternatively. You use it for very small time and just wash it off. Okay, don't just leave it off as such when you are a beginner. Once your skin is okay with that, then you can use this. Some really working sunscreen suggestions you use. I give that UV docs, okay, as a prescription I give. And there is something which is called as Sun Avenue, not the Sun Avenue which you are seeing, okay, which is being, it is a pharma brand. That is also very good. And sunscreen, when you're giving, you be very careful that you are working according to the skin type. No oily sunscreens, or no cream-based sunscreen, no lotion-based sunscreens on a oily skin, and no no aqua-based or no, not aqua-based, not gel-based on a dry skin. And this thing, what the SPF should be 50 in the now in our this time, if you are going outside and if you are onto the sun for a long time, yes, please. So you can do like that. And so I think by this, can we wind up, doctor?
There's one last question. Should we take up that?
Yeah.
Dr. Ranjit Kumar, Valmika treatment plan, please.
Doctor, can you please explain?
Dr. Ranjit Kumar, if you can unmute yourself, and can you explain the condition, please? Dr. Ranjit Kumar?
How to differentiate between dry? Okay, doctor, you can contact me. Doctor, you can give my number.
Yes, you can
How to
clear your doubt later. Yeah.
a dry and oily skin, doctor. I think the discussion part is going more wide. So
Okay, yeah, sure.
okay,
It's
so
9 o'clock and yeah.
yeah, so the topic was basically on to acanthosis.
Acanthosis, yes.
So we can have discussions based on that, and I will address this question also. How to differentiate between what is the question? How to differentiate
Dry
between
and oily skin.
dry and oily skin. See, basically how to differentiate between dry and oily skin is like once you get up in the morning, you have a you just sprinkle water on your face and use a very mild cleanser on your face. Okay, and after that you wait for 1 hour and then you use a tissue paper, you keep it on your face. Okay, you keep it on your face and you just see in a just look into the this thing now the tissue paper, and if you have oiliness all throughout the tissue paper, you are having a oily skin. When you are just having this oily this thing across the T zone, that is the nose and the forehead region, then it is a what? A combination skin type. Okay.
Yes.
When it comes to the normal skin types, you can't the oil distributions will be even. Okay, there won't be more oiliness, but the oil distribution will be even. But when it comes to a dry skin, there will be no traces of oiliness. And how can you differentiate in the climatic condition is like once you are in the winters, you get flakiness and you just have the discontinuation of the skin. Okay, when it is a dry skin. Okay, and when it is an oily skin is perfect during what? During the
Winter
season. But when it comes to the summer season, the oily skin won't be what? The oily skin won't be that good. It will be having pimple outbreaks and all. But the dry skin will be peacefully happy because the moisture and everything will be okay. Okay. And
Okay.
when it comes to the products, when you are using this Teachna, I mean penetrating products, oily skin will be okay, but the dry skin won't be that okay. You will be get flakiness and all kind of things. Okay.
Thank you, Doctor. I think with that, we'll wind up the discussion session. It was indeed a very insightful discussion as well as a session. So you covered all the different aspects of acanthosis nigricans, even the Ayurveda aspect, the modern aspect, and you also answered all the questions. Thank you so much, Dr. Anila. It's indeed a pleasure to hear you talk about cosmetology, especially something like particular topics which are, very prevalent and which we see in the OP very often. And I think our participants also agree. We are getting a lot of feedback. Thank you so much. And thank you all participants for joining us today for the free webinar. Tomorrow also we have a free webinar. It's about Ayurveda cardiology. Kindly don't forget to log in at 7:30. Also tell your friends and colleagues about this, and also the upcoming courses of AyurvedaMap. And thank you once again on behalf of Dr. Jasul and behalf of AyurvedaMap. And signing off. Thank you so much and have a good night.
Thank you, doctor. Thank you so much.